So key considerations for the Achilles. I think for an Achilles tendon, it is probably one of the more complex tendons going around because there are a lot of considerations in regards to contributing factors. But I think one of the key things is to address weakness. So if there is weakness there, to address that properly, and often that means concentric eccentric strengthening, at least to start with. Considering tendon adaptation, so do you want to try and adapt the tendon or maximize a response from the tendon? If so, you need to load it heavily. Considering length tension, so is there a length tension issue in that muscle tendon unit? If so, you may consider something like eccentric training. And then considering power, so really taking them through a progression. And power, particularly if they're going back to something like running. For me, soleus is the key. Soleus, if you look at the fascicles, the orientation of the fascicles, the length of the fascicles, it is really a muscle that is developed to work in an isometric function to control the strain of the tendon during stretch-shorten cycle. So developing exercise programs that harness that ability is very important. The other thing one of my sort of clinical rules with Achilles is no heavy loading into end of range, especially if they're in season or if they're in a little bit of a irritable, more painful phase. So care with heavy loading into end of range. So I do a lot of heavy loaded isometric work. And the key thing is looking at the kinetic chain, and this is with all tendons. So for example, tennis elbow. Have you got your rare tennis player? If so, you need to look right down from the calf right up to that sort of length through the core into the upper limb. And I think it's often something that is not done as well, but it's very important to look at that kinetic chain. So for an example, in the Achilles is hip extension. So you're lacking hip extension in gait. In running gait, there's going to be masses of increased force in push-off in the Achilles. Okay, so rehabilitation model. I think the things to consider here when you're rehabilitating any tendon is what the first thing. Excuse me. First thing and the most important thing is what is their pain? What sort of pain phase are they in? So are they in more of an irritable or more of a stable pain phase? That's going to give you huge amounts of information. I think is the most important thing. In terms of pathology, the only thing that really changes is have they got a peritendinous pathology that you may want to deal with in another way rather than your loading, or have they got something like a tear, which you may also want to deal with, and that again is linked into clinical history primarily. So clinical history guides pretty much everything. You want to assess their function very carefully. So as we've talked about today, the function and the initial function, taking them on that journey from initial to goal function once they're stable. And then you're looking at, really looking at what the activities and goals are to tie that into their function. Factors like their activities will also make a huge difference to your rehab. So for example, if they're sedentary, as opposed to going back to high-level sport, obviously that's going to make a huge difference. Their age is going to make a difference, and systemic factors that we talked about in the last lecture is going to influence the prognosis. So you need to keep these in mind. And you may be thinking about bringing in interventions that are a little bit more helpful for difficult tendons. And we'll talk about some in a second. But in terms of the loading type and progression, you can do anything really. It doesn't need to be eccentric. It just needs to target, for me, once they're in stable pain, their function and what you're trying to restore. And often there's a lot of motor control that needs to happen. So people, especially with compressive tendons, will be moving in patterns that they're getting more compression in their tendon, and you just need to change their movement pattern. So for some people, you don't need to do any endurance or strength. You just need to do power. For other people, you don't need to do any endurance, strength, or power. You just need to do motor control. So my take-home message would be just treat the patient in front of you. Just target the most important deficits once you've dealt with pain and they're stable.